Hello, my name is Kelly Gretch Henriquez. I am a Spanish medical interpreter, CMI Spanish, CHI Spanish, and I operate out of Richmond, Virginia. And I'm here today to talk about some tips for interpreting for physical and occupational therapy. So I've been interpreting for a lot of physical therapy lately, a lot of occupational therapy lately. These tips are going to be more applicable to interpreting for adults. I will say it's definitely different when you're interpreting for pediatric patients in physical therapy, especially occupational therapy. And most of these tips are going to be applicable to both in-person and remote medical interpreters. Let's face it, the vast majority of medical interpreters are likely interpreting remotely, but there are some considerations for in-person interpreters as well. So without further ado, let's go ahead and get started on my tips. We certainly hope you're not going to get up to these sorts of shenanigans these people are into, whatever they're doing on this slide, when you're interpreting. But in a lot of instances, people are distracting to patients, doing their exercises without even realizing it, which can make them lose focus or lose count of what they're doing. So definitely try not to be distracting when you're interpreting for physical or occupational therapy. I say this because I'm one of those people who can easily lose focus when I'm doing something other than interpreting, oddly enough, if someone is tapping their foot, waving their hands. So that can be very distracting, and you don't want the patient to lose count of what they're doing, to forget what they're doing, or, God forbid, for the patient to maybe, let's say, lose their footing and potentially find themselves in a dangerous situation. So next up with trying not to be distracting. So this isn't necessarily another tip. This falls under the umbrella of trying not to be distracting. I always love to mention simultaneous interpretation for physical therapy. Let's say we have a patient who is in physical therapy after having suffered a stroke. The patient is learning how to walk again. The provider is giving them instructions as they have them using a walker to try and walk across the gym. You may find that the provider is going to be giving this patient rapid fire instructions as they're walking. Put your left foot in front of your right foot. No, wait, not that foot, the other foot. Wait, no, move your foot, no. Before you interpret any of that consecutively, the patient may have already fallen. So, I mention simultaneous here because some people can find simultaneous interpretation distracting. In my training on Americans Against Language Barriers YouTube channel about trauma-informed interpreting, I talk a little bit about how simultaneous can be overwhelming or even distracting to some patients. That same patient who might be learning to walk again after their stroke, they might find simultaneous interpreting to be really overwhelming. So you might need to work with the provider to try and figure something out. But yes, simultaneous interpretation can potentially be distracting. So if you notice the patient's becoming distracted, or if the patient even says something to you like, "What are you doing? I can't understand what you're saying," because you're talking at the same time as the provider, you might need to come up with a different solution. So this kind of also falls a little bit under the umbrella of not being distracting, but physical therapy, there's going to be a lot of silence. Don't fill the silence. Be comfortable with it. You have to find your Zen moment in the silence, okay? Don't try and fill it. I feel like this is a natural human tendency. We're in a room with other people, and all of a sudden everyone gets quiet. It's awkward, right? And a lot of times, especially if you're anxious, you might be tempted to kind of fill that silence with saying things or starting conversation. Of course, if you're interpreting, you're there to interpret. You're not there to start conversation. You're not there to fill that silence. So just let it be. Now, when it comes to terminology with physical and occupational therapy, you have to know certain sets of vocabulary. And you've got to be intimately familiar with your prepositions. So of course, what comes with that first is you have to know what a preposition is. If you don't know what a preposition is, we might be in trouble here. Not only do you need to know them, you have to be able to interpret them quickly, and you also need to know, okay, in English, for instance, if I'm looking at someone, I'm looking at someone in the eyes, whereas it might be a little bit different in Spanish. So if you're studying using flashcards, I highly recommend don't study them by themselves. Study them in relation to other words and study them in context. The next area of terminology you should know and be intimately familiar with for physical therapy are exercises and exercise equipment. So some exercises have really strange names. Some exercises are named after people. Those ones are not going to be as common as things like squats, planks, things like that. So knowing basic exercises and knowing things like flexion and extension, knowing what those things are. Exercises can tend to be very formulaic in terms of names. So knowing all those different components of exercise names can be helpful as well. Exercise equipment. A lot of physical therapists I've noticed oftentimes use the names of the brands of the equipment to refer to the equipment, like the new step machine. Okay, then interpret new step machine. That's easy. But you definitely need to know some basic names of exercise equipment like treadmill, exercise bike, a balance beam, and then those handheld pieces of equipment like the resistance bands or exercise bands, knowing that oftentimes providers will use resistance bands and exercise bands interchangeably. Things like that. Exercise ball, weights, kettlebell. All of those things you should know how to interpret beforehand for physical therapy and occupational therapy. Another thing that you should know when you're interpreting for physical therapy are your muscles and your joints. If a patient has pain in a particular area of their body, the provider might kind of hone in on that area, and then they may give the patient an explanation of where they think that pain is coming from or why the pain is happening. And oftentimes in those explanations, they use muscles and joints. So I've actually been exploring something really interesting recently using ChatGPT to expand my medical terminology. I typed in, give me a list of 50 words related to physical therapy. And then I looked at the list and saw if there were any words that I didn't know. You can even kind of narrow it in. Give me a list of common physical therapy exercise names. Give me a list of exercise equipment. List all the muscles in the arm and shoulder. You can even do the same thing with joints. By no means is that going to be like your end-all, be-all point. It's not going to generate a glossary for you, but at the very least, it can help you kind of hone in on gaps in knowledge. ChatGPT AI can be your friend. We should harness it and use it. Give it a try. Now, my next tip has to deal with asking for context and for clarification. Don't be afraid. A lot of times interpreters kind of clam up and they don't ask for clarification when they need it. But a lot of times when we're interpreting in physical therapy, it can feel like this. And this gets even worse if you're interpreting remotely. Interpreting remotely for physical therapy can feel like this. She says, interpret this. Well, I don't know what's in the box and you have my eyes covered. This is where you might need to ask for context. This is where if you interpret a gendered language and the provider is referring to it, move it over here. What's it? I need to know the gender of the it before I can determine whether I use the feminine or the masculine it. That can be sometimes a cause of confusion for patients. You might not even understand what exercise they're asking the patient to do, which is why being familiar with those exercises is helpful. But even if you're familiar with exercises, you might not understand exactly what they're asking the patient to do. Don't be afraid to ask for clarifications. And also, don't be afraid to explain to the provider maybe some problem areas that you're noticing. Let's say you have that it issue in your language. The patient seems to be getting confused, so maybe reminding the provider to be specific, maybe even reminding the provider to make sure to specify what it is. And if the provider says, why are you stopping to ask me so many questions? Maybe you're reminding the provider that, you can't see what's going on. You have no context. But of course, making sure to be completely transparent and interpreting that so the patient knows what you're saying to the provider. Now, this is the last one I have a slide for, but this is a general one. So take notes because numbers are easy to forget. If the provider says, you're going to do 5 sets of 5 for 30 seconds each, but you're going to take a 60-second break in between each set, and I'll come back in 15 minutes. So many numbers so quickly. So don't be afraid to take notes. And I say don't be afraid because so many in-person interpreters, it's like they think they're a bad interpreter if they're taking notes. I say that's a sign of a good interpreter to have a notebook with you and to be taking notes. So if there's one thing you're going to take notes on, if you're taking notes while interpreting for physical therapy, it's going to be those numbers. So now we get to the tips that are specific for in-person interpretation and remote interpretation for physical and occupational therapy. So for in-person interpretation, my number one recommendation is to not stare at the patient. Imagine this. You are doing your exercises. Or let's say you're at the gym and you're doing your exercises and there's someone sitting across the gym from you just staring at you. How does that make you feel? Wouldn't you get up and go up to, I would. I'd get up and go up to that person and be like, what's your problem? Why are you staring at me? So it can make people feel uncomfortable. It might make people feel self-conscious. Maybe they're not going to be comfortable doing their exercises in front of you. Maybe it's distracting. Maybe they'll lose their focus and maybe not do their exercises correctly, or God forbid, maybe they'll hurt themselves. And then the other thing too that happens is when you're staring at the patient is they might think you're counting their repetitions. So that's another reason why you don't want to stare at the patient when they're doing their exercises, is they might think you're counting their reps. How many was that? Or they might not even ask you. They might just be going and going and going and be like, well, when am I supposed to stop? No, don't do that. Don't set that expectation. And you know what? You shouldn't be counting the patient's reps. You have to stick to your role. You have to be a medical interpreter. I've certainly been in situations where physical therapists have asked me to do things that I just shouldn't be doing as a medical interpreter, to make sure that the patient's doing their exercises correctly, to count the patient's exercises, or just even to accompany the patient and, make sure to come back to the provider and let the provider know if the patient needs any help. Usually, if that happens, I'm going to sit as far away from the patient as possible. I shouldn't be there to kind of like spot the patient when they're doing their exercises. If the provider really thinks that the patient needs that, the provider should be keeping an eye on the patient, not me, the interpreter. That's not my job. And I don't say that to be lazy. I say that because, well, sometimes people get the wrong impression. Sometimes they think we're kind of like their assistant, there to help them. But I'm not there to be your assistant. I'm there to interpret. That's a dangerous road to go down. Now, obviously, that doesn't really apply. Well, it can apply in some cases to remote interpreters, but I will say this. Remote interpretation for physical therapy can be really, really difficult. It's like you're in a dark room and you have earplugs in your ears sometimes, trying to figure out exactly what's going on to be able to try and interpret it. So if you find the patient is really, really struggling, if you find that over the phone interpretation just isn't working for the patient, that it's really causing difficulties. Now, when I say this, by no means am I trying to say that in-person interpreters are better than remote interpreters. In fact, I think you have to be more skilled to be a remote interpreter. You don't have all your tools in your toolbox, and it's really hard. So in those instances where you're noticing that the patient's really struggling, a lot of times providers, they'll even get like frustrated. They'll even be like, oh, this is so difficult. I don't know how I'm supposed to do this over the phone. If you are able to, maybe gently suggesting to the provider to use a video remote interpreter if possible, or to utilize the services of an in-person interpreter. Again, by no means am I saying in-person interpreters are better. I'm just saying that in this particular setting and in other settings, sometimes it's just so difficult to interpret over the phone. So if you are struggling, try these tips. Of course, consult with your colleagues to see what helps them. Talk with other medical interpreters. I like to always post a link to the professional communities that I'm a member of on Facebook with professional interpreters, because it's a great place to kind of field questions, ask for advice. And you know what? I'm not the end-all, be-all source of tips for medical interpretation. And you know what? Not all of these tips might be helpful or relevant to you, and that's okay. But if you have a tip that you'd like to share with other people, because the goal here is, to get some tips together to try and tackle these medical specialties, physical and occupational therapy. If you have your own tips about interpreting for physical or occupational therapy, put them in the comments below. And of course, as always, make sure to follow my channel, subscribe, turn on those notifications, and that way you can stay up to date on all of my recent videos, and you'll get a notification anytime I post one.